Niemann-Pick disease is a rare and serious genetic disorder that affects lipid metabolism in the body. It was first identified in the early 20th century and is named after Dr. Frederick Niemann and Dr. Ludwig Pick, who made significant contributions to our understanding of the disease. This condition is caused by mutations in specific genes that lead to the accumulation of lipids, particularly sphingomyelin, in various organs, primarily the spleen, liver, lungs, and brain. There are several types of Niemann-Pick disease, but the most common are type A, type B, and type C. Type A is a severe form that typically presents in infancy. Infants with type A often show symptoms such as failure to thrive, progressive neurodegeneration, and developmental delays. They may also have an enlarged spleen and liver, leading to abdominal swelling. Unfortunately, this form of the disease is rapidly progressive and most affected children do not survive past early childhood. Type B is a less severe variant that also presents in childhood but is characterized by a later onset and a slower progression of symptoms. Individuals with type B often experience organ enlargement, particularly of the liver and spleen, and can develop respiratory issues, but they tend to have a better prognosis compared to those with type A, with many surviving into adulthood. Type C, which is the most common of the three types, can begin in childhood or even in late adolescence or early adulthood. It involves a defect in lipid transport, leading to significant neurological impairment and can cause a range of symptoms, including difficulty with coordination and balance, behavioral problems, and cognitive decline. Diagnosis of Niemann-Pick disease generally involves a combination of clinical evaluation, family history assessment, and biochemical tests. Enzyme assays can identify deficiencies in sphingomyelinase for types A and B, while genetic testing can confirm specific mutations associated with type C. It is important for healthcare providers to consider Niemann-Pick disease in children presenting with unexplained neurological or developmental issues, especially if there is a family history of similar conditions. Currently, there is no cure for Niemann-Pick disease, and management strategies focus on alleviating symptoms and improving quality of life. For type A and B, supportive care, including understanding respiratory support, pain management, and nutritional therapy, is essential. Physical and occupational therapy can help maintain mobility and independence in these patients. For type C, more specialized treatment options are being explored. Research is ongoing into therapies that may modify the course of the disease. Substrate reduction therapies and investigational medications are under study and hold promise for managing symptoms more effectively and potentially slowing progression. Families affected by Niemann-Pick disease face emotional, social, and financial challenges due to the complexities of managing a chronic health condition. Genetic counseling is vital for families, as it helps them understand the risk of the disease occurring in future pregnancies and can support informed reproductive choices. Support groups and organizations dedicated to Niemann-Pick disease provide crucial resources. They create awareness, promote research funding, and connect families facing similar struggles. This community can be an invaluable source of support, helping families navigate the challenges associated with living with this rare disease. In conclusion, Niemann-Pick disease is a complex genetic disorder that significantly impacts the lives of those affected. Understanding the different types, symptoms, and management options is critical for caregivers and healthcare providers alike. As research continues, the hope is that new therapies will emerge to improve the lives of individuals living with Niemann-Pick disease. Thank you for watching, and remember to like, comment, and subscribe for more educational content about rare medical conditions.